And then I said, you know what? Let's take care of the medical things. And then all these things are no big deal, right? Blah, blah, blah,
Mhm.
blah. And then she shows up 6 months later and she said, you changed my life that day. She said,
Mm,
I left here and I had a different outlook than when I came in. I had
mm.
no idea. I mean, I was just talking to her.
Yeah.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. I have Misty Shed, owner and lead injector at Youthful Infusion Med Spa. She is a nurse practitioner with a Master of Nursing and certified aesthetics nurse specialist since 2013. She's a top requested Allegan Medical Institute faculty trainer and is recognized for her unique blend of patient care, exceptional injection skills, and patient outcomes. She attracts patients from all over the world for her skills in muscle relaxers, dermal fillers, and fat dissolution injections. So Misty, welcome and glad to have you here.
Hi, thanks for having me.
Yeah, so let's dive into it. So Misty, how did you first get interested in aesthetics?
Mine was kind of interesting because I've been a nurse for a long time and moved back to Texas and the thing about nursing is so awesome. There's so many different types of nursing. So when I came back, I wanted to do something a little different. My background is trauma, ICU, ER, things like that.
Mhm.
Moved back, had kids, and wanted to do something different. So I went to work for a plastic surgeon.
Hmm.
And at the time, not a lot of people were doing injectables and things like that. He was doing it because he had to. I mean,
Mhm.
requested, he wasn't good at it. So I begged him to let me take it on. So it's probably been like 20 years ago. He let me take it on.
Mhm.
And at that time, only mainly derms and plastic surgeons were doing it.
Mhm.
So I just kind of built it from there. So it was a fun and different, and I enjoyed it. I enjoyed people. So it
Mhm.
was a way to get close to people too. And I think I do it a lot better than he does. He just
Okay.
does surgery.
Yeah. Okay.
Yeah.
Got it.
Yeah.
So, can you discuss some of the most popular treatments that your patients come to you for, and also why do you think that they're the most popular ones?
Well, I think it's kind of in the progress of changing too a little bit.
Mm.
I think Botox used to be our number one thing that got people in because it's easy, it's
Mhm.
simple. People can do it at lunch. There's really no downtime, and it's
Mhm.
such a big bonus when it kicks in and people see it.
Yeah.
But I think our fillers are moving up. A lot
Mm.
more people are doing the fillers. I hate that word, by the way, filler, because it kind of makes it a negative to me.
Mhm.
But a lot of our different fillers we use and lasers and things like that. It's just not as big of. It used to people were afraid to talk about it, and
Yeah.
now people will talk about it. So
Mhm.
any little thing that kind of gets them in, and we start talking, and a lot of people don't even know what all we do, right?
Mhm.
Or they
Mhm.
think Botox does the same thing as fillers.
Yeah.
So a lot of it's education and just kind of seeing what the patient needs.
Okay. Now, you bring up an interesting point is that people come in, they maybe think that they want one thing or they think that it does something that it doesn't. So, what would you say are some common misconceptions that people have about the treatments that you provide?
Well, number one, I would say we do it every day, so we think people know what we do here
Hmm.
and know exactly how to do it, and you
Hmm.
find out that they don't. I mean, I had a
Yeah.
patient one time that had gone somewhere else for fillers, and when I talked to her why, she had no idea I do
Hmm.
fillers, right? That's
Hmm.
on me. I should have done a little bit more education of what we do. A
Hmm.
lot of people think Botox does everything,
Hmm.
and then they'll point to different lines and things on them, and I'm going, well, that's not actually Botox. They don't even know the difference of
Hmm.
how to do it. So, and nowadays with social media, there's a lot of people are a lot more informed than they used to be,
Yeah.
especially the younger, but not necessarily in the right way.
Hmm.
So sometimes it's education of, okay, that's not exactly what you see on, the internet.
Hmm.
So it's a lot more education. My appointments are longer now
Yeah.
because people want to know more too. And I think they need to know more. I mean, these are things going into their face,
Hmm.
and it's a medication. If a doctor puts you on a medication or things like that, you would want to know what it is. Sometimes they trust us a little too much.
Yeah. Okay. Now, I'm
Yeah.
sure you get people that come in and they want that Instagram filter look that's just not
Yes.
realistic.
Right. It's not realistic. Right. And sometimes it's always people don't come in necessarily for one thing. And sometimes it's maybe they lost their job and they're older and they're trying to get a job. And so they
Mm-hmm.
feel like they need to compete.
Hmm.
Or it's a lot of inner things that people are working on. Maybe they feel bad about their weight and they're taking it out on their lips, or, or just trying to do different things, or maybe certain lip lines, somebody commented about them, or that's why they look older. So there's usually some reason that got them there in the first place.
Got it. Now you're talking about educating. So educating your patients, educating your clients on the services you offer, but also the benefits. So how do you approach that education, like particularly for someone that maybe doesn't know much about what you offer, and the other person who thinks they know, but what they think is not right?
Right, exactly. And it's very hard for people in the medical profession. For me, in fact, I'm not a salesman, never wanted to be a salesman. I'm not good at it, anything else. So sometimes it feels a little bit salesy when we're doing these consults and things. So to help me, I do it more about education, right? I'm not trying to get them to buy something just to buy something. I'm trying to tell them the why and where. And I think the more they know, the better off in the end. I'm not really selling, it's just what it's going to take to do what they want to do, right? So even during COVID, we had to lengthen our appointments, because used to when I first started, there weren't a lot of options, right? We had like 2 options and it went everywhere. So now we have way more options, way more products and things like that. So when COVID hit, I made my appointments longer because we had to. And I actually have not taken them down because people they want to know. And the first step, and I think that's what there's a ton of people that do injectables. And you've got to say, what makes you different than everybody down the road, right? So, and I think a lot of it is about the education and showing them why we're doing it, what their options are doing it. And it doesn't have to be expensive, right? And we can keep with their budget in there, and we can even have a plan. So sometimes, I know me, I like plans, right? And if I have a plan, I'll keep up with it. I may not be able to do it all now. And some people want everything now, but then some people, want a plan. Sometimes it's a wedding you're getting ready for. So those we're going to do a little bit faster than somebody that we wouldn't. Nowadays with the younger crowd, they may not need as much as somebody that's 50, 60 and never done anything. And now they're son or daughter's getting married, and it's going to take more products to do it. And a lot of people, sometimes it's not even the money, I'm finding out, it's more about being overdone. They've seen the people that are overdone. They say, what is it they say? They say that it's never a compliment when somebody says, who's your injector?
Oh, yeah.
So, it's a little bit like that, as far as it just gives it a bad name, the ones they've seen that are terrible. So sometimes it's even figuring out what is their fear. It's not the pain, it's the fear of being overdone, and it's their face, and they wear it every day. So it's just kind of giving them our options, and then they get to decide what they do and don't want to do. And, and sometimes I'll say, you have to do this part first. You can't wait. And then sometimes they have more options.
Okay, got it. Now, you brought up that terminology of being overdone. Now, I'm hearing more and more from practitioners out there that their patients, their clients are asking them for more of a natural look. It seems like kind of where the trend is going to. Is that kind of the same thing you're seeing with your clients and your patients?
It really is. It really is. And we still have our few that want to overdo, but for the most part, that's everybody's fear. It's because when I really ask, okay, what are you afraid of? They're afraid of being overdone, right? And the products, you almost can't overdo somebody in one day, kind of thing. It's usually the people that do too much too often and overdone a little bit. So, it's one of those things that you've got to kind of talk to their fears about it, because usually, and the money is expensive. It is, but it's our face, and it depends on what age you started, kind of thing. And it can get expensive fast. And I realize that. And again, I'm not a salesman, so I just need them to know I believe in the products I'm going to sell them, and I would do it to my mother or my sister or whatever, but giving them options.
Got it. Okay. Now, you talked about one of your differentiators was the amount of time you spend with your clients. So talking about differentiators, what kind of sets your practice apart from everyone else in the industry, what would you say are some other differentiators that really set you apart?
Sometimes it's not easy, with patients, because there's lots of different personalities you're dealing with, right? And then sometimes I say all the time, I'm a psych nurse and I'm not a psych nurse, but usually if somebody comes in and they're already nasty, I'm like, okay, what happened because I said hello is all I said. Right. So sometimes injecting is not for everybody, because again, my plastic surgeon is used to patients being asleep. Right? And I have to deal with them on a daily basis. And maybe they had a fight in the parking lot over a parking spot. So, or there's all these different things that I just try to a little bit empathy maybe. Some people fully have high pain tolerances than other people. Some people it's not the fear of pain, but they work themselves up so much. So I think it's just listening. I've sat there for plenty of times when somebody got a bruise and they're screaming at me and yelling at me, and I'm like, look, I would take it away in a heartbeat. And somehow they just feel better that they got to vent.
Yeah.
So I think sometimes it's just listening, individualizing them, and not saying everybody's just the same and it's not cookie cutter. I think that makes a difference too. And I think they need to be heard. I mean, they say that, you may not know what they did, but you know how you felt when you were there.
Yeah.
Right. So I think a lot of us, I even tell all the girls that I train, I said, think about how you would like to be treated. We've been in plenty of offices where you walk in, doctor's offices, and they're already mad. It's like they're mad you walked in. So you're like, I just got here, I haven't even done anything. So I always tell them, treat people like you would, look them in the eye, listen to them. Sometimes they just need to be heard, and because they're spending a lot of money, right? And it's their face. And I think sometimes one time one of the guys that had been injecting, he got fired or something. They'd asked me to cover for him. And this is just how different people are. And so I walk in, this has probably been 10 years ago, and I go, hand him the mirror, and I'm like, okay, what would you like to do? And she was just appalled that I would even ask. She's like, he always does what I need, and he never asked me. I don't understand why you're asking me or why it's even a problem. I'm like, I can do that too. We can do that. And then the next patient comes in, and I hand her the mirror, and she says, oh, thank God you're asking me what bothers me, because he never did. And he just did what he wanted to do. And this was back-to-back patients, just figuring out their personalities. Sometimes I think we talk a lot, and it's a lot of jargon they don't know. And I think it's just sometimes to listen and explain to them, or maybe take it slower than you would some people, and knowing when to say no.
Yeah. Okay.
Knowing when to say no too.
I got it. Now, you talked about like the different treatments that you provide and kind of in what situations that they're needed. Are there any new or emerging treatments that you're particularly excited about?
There's tons of new things. So here, I'm trying to always be up and going with what's kind of new. And, we're doing the IV treatments, and you have lots of peptides, and exosomes are something that's really new and exciting. And we're kind of learning what we like, what we don't. And then you've got all kinds of different lasers. Lasers are coming out all the time. There's different lasers for your face. Now there's tons of body things that are coming out, so not only our face we're working on, it's body too. A lot more men are coming in, right? Okay. And probably today was one of my really heavy, I probably had more than half were men. And men care, and it may be, I have an older man, and he's still working, and he's in his 70s, and he wants to look not mad. He's in sales, and all these young ones coming in, he doesn't want to look mad. So his Botox kind of calms that. And we also have, every day there's something new. And it's just trying to figure out what works and what doesn't, because some things that they're trying to sell you are, kind of crazy and wild. And then probably the exosomes things is the newest and most exciting.
Got it. Okay. Now, talking about treatments, and I think this is very even more impactful since you worked at a plastic surgery center. How would you describe the biggest differences between the treatments that a medical spa provides and the treatments that a traditional cosmetic or plastic surgery practice provides?
Which is kind of what I fight, especially now that I've opened the spas a lot, because people are like, oh, for this price I could have a facelift. Well, number one, no, you can't. But they work really well together. They don't even do the same thing, right? So your facelift is usually just taking skin. It's not helping the volume for somebody that's thin and doesn't have the volume already. So they work really well together. And I think some plastic surgeons don't tell patients that. A lot of them think they'll never need to do Botox again. They never need to do fillers again. And it is not the case. I mean, maybe for 3 months or so, but then they'll start having to add these things. And then a lot of surgeons just put it all in their consult, and they'll tell them, you need the facelift, and then we'll do these different injectables. So they work really well in unison, but not necessarily one versus the other.
Okay.
And then I think a lot of people are either not getting a facelift or pushing it back in time, right? Because they don't have to with the things we're doing.
Okay. Got it. Thanks for explaining that.
Yeah.
Now, when it comes to your clients and your patients, could you describe how you balance providing that relaxing experience, that relaxing environment for them, but also at the same time ensuring their safety and well-being during the treatment?
Right. Which is something very important to me. I think it's kind of gotten out of not as medical for, you hear and see all these different people doing it in parties and things like that. And there's a big group of us that are trying to go take it back to medicine, right? These are prescribed medications and it's not necessarily for everybody. And we really need to be using the right things. We all hear horror stories of things that were given to people that they bought off the market and things like that. Or I've even seen where a couple of people have bought stuff off Amazon and injected themselves and then having to pay the price. So it looks, with our social media, it looks like easy. It looks like anybody can be trained to do it, but it's still medicine, and we still know there's lots of arteries, lots of vessels that we can occlude, and we're all trying to take it back there and make it more serious than it's looking out there. I know on social media there was some, and I don't remember which state, I think it was California, a stay-at-home mom had seen enough online. She was teaching people how to do it. She was buying it on Amazon, and which is fine until it's not fine.
Yeah.
So I think keeping in with making sure you know all the patient's medications, making sure you know their medical problems, and then the other thing is being there, because it's not if something happens, it's like anything, it's when kind of thing. As I tell my patients, yes, things can happen, and yes, they sign consents for all of that, but guess who's here when it does happen? I'm here, and I have ways and people to talk to and here for you to, to help you.
Yeah.
And I think instead of being like a fly-by-night place where they can't even find them when it happens.
Yeah. Now, speaking of that, I'm sure that you've run into particularly challenging cases throughout your career. So could you talk about maybe one story of a really tough case that you came across and really how you were able to get them a successful outcome in the end?
Well, I actually have a couple. But one of them was, and it's more for me, as you can tell, I'm a big mental person. I'm very empathetic with people. But one of them was a younger girl. I love it when people don't have to do, right? So it's cosmetic and we like it and things like that. But when it gets really deep, emotional kind of thing, I had a girl who was in high school. Her mom brought her in and she has no chin, right? And she got made fun of a lot and things like that. So her mom, number one, already felt guilty bringing her in, that she would even think about doing something at her age. And we talked about it and things like that. We ended up doing a chin on her, and her mom texted or sent me a message talking about how it's changed her whole life, right? She wasn't afraid anymore, and she was more outgoing, and she just felt better about herself. So it's times like that you feel like, okay, it is all worth it. Because sometimes we look at the meaningless nothing part of it, and for some people that was a really big deal, or even I think it's called the lollipop theory. Have you ever
I have not heard that. No.
It's pretty interesting. It's it's about maybe somebody said something to you one day that was like no big deal, but it changed your life, kind of thing. So there was one day I had a lady, I'm putting an IV in, and just talking to her as I'm putting the IV in, and you find out more and more, and she's been through all these surgeries. The year's been terrible. She has cancer, she's doing, and then she had to have feeding tubes, all these different things. And just talking to her, and she was talking about how terrible skin looked and how, she's gotten old. And then I said, you know what, let's take care of the medical things, and then all these things are no big deal, right? Blah, 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 blah. And then she shows up 6 months later, and she said, you changed my life that day. She said, I left here and I had a different outlook than when I came in. I had no idea. I mean, I was just talking to her.
Yeah.
So I guess just realizing how you can change somebody's life, with even just saying, hello, your eyes are pretty, or something like that. And maybe it was a bad day for them. But times like that is kind of when I really enjoy what I do. And I go, okay, these are the days that it's really worth it.
Yeah. It's very interesting because the story that you told, it's a very common theme with a lot of practitioners when I ask them, like, what's their best success story? And I think that's a big thing that people from the outside looking in don't realize, is that they look at the aesthetics industry like, oh, it's all about vanity, it's all about looks, it's all about cosmetic. But for all the practitioners, their best success stories are the ones where people had some type of deficiency or deformality and they fixed it and it changed their life. And actually, like, change their life is a very common term that they use. It changed their life, or it changed my life. Like, that's what they tell them. And I think that's the part that a lot of people don't realize, like the emotional impact that this industry can have on people, not just about looking better, but really changing their life and turning their life around.
It's how you feel about yourself, right?
Mm-hmm.
And that's why they say a lot of times, Botox helps depression, right? And you're like, no way. But if you think about it, I mean, if you put it and you feel better, but not only that, if I'm not frowning, maybe people come and talk to me more often.
Yeah.
Maybe they don't think I'm, mean and things like that. So even that alone would change, how you feel about yourself and everything going on around you.
Yeah. So I think
it makes us feel like it's worth what we do, because some days you're like, okay, this is, so petty, but it also takes us back a little bit to our nursing side, because usually nurses were very empathetic. That's why we're in it. And we go, look, we are making them feel better and things like that.
Yeah, no, I think it's a very important point to make, especially for people who don't really realize that there's a lot more behind it than just the aesthetic side.
Right. And they may be young, like I said, and they're going, oh, they don't need it. But maybe like this girl, it changed her life.
Yeah, exactly. Now, when it comes to the treatments that you provide, or really just medical treatments in general, I know a lot of people think of it as a very step-by-step methodical process, but what role do you think that creativity plays in how you approach patient care?
That's an interesting question you ask, because all the time I get people go, you're an artist, oh, you're such an artist. And I go, I don't have an artistic bone in my body. I can't draw anything. I can't do it. Oh, yes, you are. Yes, you are. So I do know, I see lots of people that are really good plastic surgeons and injectors who really are artists. They can draw and do great things. Not me as much. I'm more of a math and science girl, right? And I always want to know how. Why do I see that? Why is it different? What's going on? Are they biting that cheek? Why is this one a little bit bigger than that one? And I'm more the math and science part of it, and just kind of going, do you sleep on this side more? Are you left-handed? You right-handed? So I kind of go at it a little bit more that way. I do think you get used to seeing, like I said, I'm not an artistic person, but I do pay attention a lot. Like if I see somebody who I go, those are just great cheeks. And I kind of look at it and go, okay, why? Why do I think they look so great? And so I'll kind of take it that direction, but forget art work for me. I'm just like, so.
Okay, got it. Now, Misty, where do you think the future of aesthetics is going?
Hopefully, well, I think one day, probably past my time, but one day I think we'll be able to take a pill and probably decrease in age from the inside out, become young kind of thing. But I do see steps of it taking it back to medicine, right? And making it what it really is, and an important thing that we're not overdoing to people or getting it at the wrong place, or doing the right things for people, and not making it, just something you get on every corner. I think there's more and more. Now you have more and more companies in, and we'll start to see amazing things coming out, and different kinds of fat. And like I said, the exosomes are just on the verge of different things. I think you'll see more and more things where even we'll be shocked of all the different options for us.
Okay, and as you're mentioning, there's a lot of new products, treatments coming out in the marketplace. So regenerative medicine, which is exosomes you were talking about, functional medicine is another word that I'm hearing a lot of practitioners' lips. So do you feel like that's the direction things are going, like the aesthetics practices are going to be taking more of the functional medicine, regenerative medicine, and combining that into their aesthetic approach?
Yep, absolutely. And I think everybody's taking the psych into it also, and I think it's going to be like a one-shop kind of figuring out what else is going on. You're getting your hormone. You're doing a lot of the hormone therapies and things like that here too. Like we do the hormone pellets and therapy. So I think once you get all of that combined, you'll start to see a lot more blood work where we'll start reading blood and seeing, who needs what and things like that. I think that's kind of where it's geared to go in, to treat the whole you.
Okay, got it. That's gonna be an interesting future.
Yeah, it will be. It will be. I know Allergan alone, I think they have think tank kind of concept where there's so many things that it's like you would want to bathe in it and just go, okay, just put my whole body in it.
The fountain of youth, literal fountain. You walk into the fountain.
Exactly. For sure.
Okay. Now, Misty, I have one last question for you, but before I ask it, I want to point people to your website at www.youthfulinfusionspa.com.
Yes.
Now, the last question is, what is the most important piece of advice you can give to someone who's thinking about getting some type of aesthetic procedure or treatment done, but isn't sure which provider to choose?
That's a tough one because it's nowadays, social media, it kind of changes everything too. I would ask friends. Friends, if they will tell you where they go, kind of like hair, when you see somebody's hair and you say, hey, where do you go? If they go somewhere, so maybe take hints that way. Hairdressers usually know too who they like and who they go to, and then you can kind of it goes the other way too. You can almost know who not to go to if you look at them and you go, okay, maybe not that one. But going in and asking questions, treat it like you're at a doctor's appointment, right? And if they recommend something, say, okay, what is it and why? And how's it made? Was it last? Ask more questions. I tell patients they trust me way too much sometimes. They're like, whatever you think. And I'm like, no, I want you to know what's going in your body, right? If somebody puts you on a blood pressure pill, or something like that, you're going to want to know what it is and how much, and then we're going to check back. So kind of same thing as just asking the questions and getting options. And sometimes that's, going to 3 people, just like surgeries. I tell them it's perfectly fine to sometimes it's who you feel most comfortable with and who you think is going to be there, or maybe who's listening to you, or they know where you want to go, right? And it's not a cookie cutter. So I think most people don't look at price, right? It's your face. It doesn't necessarily mean that's the best place for you to go. I mean, it is your face. You can't cover it up very easy. Yes. So see what your options are, I would say. And then, nobody likes somebody that's constantly selling. I hate it when I go in a store to buy clothes, right? I don't like somebody constantly pushing me to try something on and things like that. So just see what your options are. Don't feel pressured. It doesn't have to be that day, right? They may push you to do it that day. It doesn't have to be that day. It can just making sure your options and, they're listening and you think they know what you want. And sometimes you take it slower than others.
Okay. Great advice. Well, there you have it. Misty sharing her expertise. Now, Misty, where can people contact you in your practice?
We just opened our 3rd one recently. So now we have Allen in Allen, Texas, at Youthful Infusion. And we just opened one in Grapevine, Texas, and we have one in Tyler, Texas. So Youthful Infusion, and we are on the website. We have our website, and then our phone number. I can give you our phone number at Allen anyway, 972-908-2772. And we are always happy to answer any questions anybody has and anything we can do to help. Perfect. I have some amazing staff. And we're getting more all the time.
Excellent. Great. Well, Misty, thanks for being on the show and sharing your message.
I really appreciate it. Thank you. Bye.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.